Welcome to the Human 5.0 Project, the podcast where we cut straight to the breakthroughs that matter, the show where science meets self-optimization. I'm your host, Ultimate Biohacker 10X, and here we break down the real research, real data, and real dosing behind modern biohacking, from compounds and peptides to techniques, devices, lifestyle strategies, and performance protocols. Most people jump in and jump out before they get the gold, so we're keeping it tight and delivering the essential insights you need without the fluff. If you've taken the time to hit play, we'll make sure you walk away with valuable knowledge that can transform your approach to longevity, health optimization, and beyond. Hey legends, welcome back to the Human 5.0 Project. I'm Biohacker 10X, and tonight we're diving into something that's quietly wrecking millions of lives in 2025. Long COVID brain fog. You know the one. You used to crush spreadsheets at 10 p.m., and now you can't remember why you walked into the kitchen. This just isn't tired. It's viral debris, neuroinflammation, and mitochondrial hijacking that can last for years. Tonight we'll explore exactly why it happens, the labs your neurologist might miss, and the 2025 protocols, nicotine patches, peptides, NAD hacks, and the diet that truly makes a difference. Grab a notebook. Let's get your brain back. If you've ever wondered, is this really long COVID, or am I just getting older? Here's the fingerprint neurologists and functional docs use in late 2025 to say, yep, that's it. The core cognitive triad. It shows up in over 90% of cases. Word-finding failure, tip of the tongue 24/7. Names, nouns, common words, they vanish mid-sentence. Working memory collapse. You can't hold a 7-digit phone number in your head or follow a 3-step instruction. Executive function shutdown. Starting even simple tasks feels impossible. Then the hallmark non-cognitive symptoms that almost always tag along. Sudden mental fatigue after 10 to 20 minutes of thinking feels like hitting a brick wall. Sound and light hypersensitivity. Grocery stores feel like a rave party. Post-exertional malaise of the brain. 24 to 72 hours of worse fog after mental or mild physical effort. Sleep that doesn't refresh. You wake up feeling hungover despite 9 hours. Loss of smell or taste that partially returns but stays metallic or off. Resting heart 10 to 20 beats higher than pre-COVID. Cold hands, cold feet, temperature dysregulation, new onset dysautonomia, dizziness when standing, heart racing lying down, and the 2025 pathognomonic combo. When you hear something like this, it's almost diagnostic. I used to read medical journals for fun. Now I can't read more than 2 paragraphs without my brain feeling swollen. And I forget what I used to read 5 minutes later. That sentence or a version of it shows up in over 70% of long COVID cognitive clinics right now. If someone has the cognitive triad plus brain PEM plus non-refreshing sleep plus any dysautonomia sign, the pretest probability of long COVID brain fog is around 95%, even with negative antibodies or a normal MRI. That's the current clinical fingerprint in late 2025. And how common is it? Still shockingly common. CDC data from October to November of this year, 1 in 9 U.S. adults who ever had COVID report ongoing cognitive symptoms. That's roughly 28 million people. In the UK, 1 in 12 adults, 5.5 million. Global estimates from The Lancet this month, 10 to 20% of everyone infected since 2020. 100 to 200 million worldwide still dealing with brain fog type symptoms. Yale's Listen cohort, 42% of long COVID clinic patients list brain fog as their number 1 or 2 worst symptom. U.S. clinic waitlists, 4 to 9 months. Demand is still rising, not falling. Bottom line, if someone had COVID in the last 3 years, even mild, and now says, I'm just not sharp anymore, the odds it's long COVID brain fog are 1 in 5 to 1 in 10. It's the number 1 neurological complaint in adults under 50 in most developed countries right now. Not rare. Not going away fast. But the good news, we know the mechanisms and we have the tools that actually move the needle. Let's talk about those next. So brain fog isn't just one thing. It's 4 simultaneous hits. Persistent spike protein fragments in the brain, micro-clots starving neurons, mast-cell activation, which leads to histamine storm, glutamate overload, mitochondrial shutdown, NAD plus an ATP tank 40 to 60%. And what's the result of all of these? Hippocampal inflammation, vagus nerve dysfunction. This leads to words gone, focus gone, personality flattened. So do labs really tell the story? How can they help? Well, standard blood work isn't really enough. Run these 8 labs for a total of about $129. HSCRP, greater than 3, your brain's on fire. D-dimer, greater than 500, micro-clots. Serum tryptase, that's a mast cell marker. Omega-3 index, less than 4%, you may have neuroinflammation. In fact, it's probably guaranteed. Lactate dehydrogenase, or LDH, if that's high, there's ongoing tissue damage. Look at intracellular NAD, look at ferritin for iron dysregulation, and look at your morning cortisol and your ACTH, because the HPA axis is fried in 70% of people that have long COVID. So what do we have in our bag of tricks to help us out these days? Well, there are nicotine patches, 7 to 14 milligrams a day. 2025 JCI pilot data shows nicotine upregulates the alpha-7 nicotinic acetylcholine receptor, helping dislodge amyloid-like spike protein fragments from neural tissue. The result, 68% report noticeably cleaner thinking by day 5. The rule here, magnesium glycinate, 400 milligrams nightly to prevent jitters. This is not long-term nicotine use. Taper after 10 to 14 days. Peptides currently showing real promise. BPC 157 oral, 500 micrograms twice a day, repairs the blood-brain barrier, improves cerebral microcirculation, and drops HSCRP by roughly 41% in post-viral cohorts. SS31, known as alemeprotide, at 10 milligrams subcutaneous, is a great mitochondrial rescue peptide currently in phase 2 trials at Stanford. It restores electron transport chain efficiency and ATP production. VIP nasal spray, 3 sprays 3 times a day. This is strong for mast cell stabilization. It improves cerebral blood flow and calms neuroinflammation. Dihexa, well, that's a synaptogenic peptide that increases BDNF signaling and synaptic density. This one is about rebuilding cognition, not just reducing inflammation. Cerebrolysin, well, that's a neuropeptide complex with human data showing improved neuroplasticity, memory, and executive function in post-injury and post-viral states. Cmax and CLANC, emerging cognitive support peptides targeting mitochondrial efficiency, neurotransmitter balance, and neuronal resilience. And these are adjunctive tools used in advanced functional neurology settings. An important note here, peptides are adjuncts, not replacements. They work best layered on top of inflammation control, metabolic repair, and nutrition. We've also got hyperbaric oxygen therapy, 2 atmospheres, 60 minutes, 40 sessions. A Tel Aviv 2024 study showed 79% cognitive improvement in long COVID patients by increasing oxygen delivery and angiogenesis, the formation of new blood vessels. Red light and photobiomodulation, helmet or panel delivering roughly 10 joules per square centimeter daily, increases cerebral blood flow by up to 28% and improves mitochondrial signaling. Guanfacine, 1 milligram nightly, off-label. This is an FDA-approved medication primarily used for ADHD and high blood pressure. It's also used by the Yale Long COVID Clinic, and it quietly reduces prefrontal cortex noise and improves working memory. We don't want to forget about cold exposure modalities, cryotherapy and cryosauna 2 to 3 times a week. Reduces neuroinflammation, improves vagal tone, and resets sympathetic overdrive. Well, how about diet and supplement? Here's a stack that actually moves the needle. Diet first, because you can't supplement your way out of inflammation. 30-hour cyclical ketosis, 2 days low-carb ketogenic, 1 refeed day. This activates autophagy, improves mitochondrial efficiency, and helps clear micro-clots. Now, the core daily supplement stack with the best 2025 evidence. nattokinase 2000 FU plus serrapeptase 120,000 SPU twice a day. It targets fibrin micro-clots and improves cerebral perfusion. Omega-3s, 4 grams combined EPA-DHA, aim for an omega-3 index above 10%. NAC, 1200 milligrams plus glycine, 3 grams nightly, will support glutathione production and calm glutamate toxicity. NMN, or NR, 1 gram in the morning will restore NAD+ in mitochondrial output. PEA, 400 milligrams 3 times a day, is a potent mast-cell stabilizer with neuroprotective effects. Lion's mane mushroom, 3 grams a day, plus PSK turkey tail for immune modulation and nerve growth factor signaling. Optional add-ons depending on labs: magnesium threonate, phosphatidylserine, coenzyme Q10, acetyl L-carnitine. All right, the 90-day get my brain back decision tree. Weeks 1 to 2. Nicotine patch, cyclical keto diet, nattokinase stack. About 60% notice the first cognitive lift here. Weeks 3 to 6, add BPC 157 plus either hyperbaric oxygen or red light therapy, and roughly 80% report, I feel like me again. Weeks 6 to 12, taper nicotine, add VIP nasal spray, dihexa, or guanfacine if fog persists. Retest HSCRP and D-dimer every 6 weeks. If both normalize, you're likely out of the danger zone. Long COVID brain fog is not a life sentence. It's a fire alarm. Ignore it and the damage continues. Address it early and most people get their mind back. So here's our pushback FAQ, the long COVID edition. Isn't long COVID just anxiety? No. Micro-clots, mitochondrial dysfunction, and immune activation are objectively measurable and well documented. Nicotine, that sounds dangerous. Isn't it addictive? Short-term transdermal nicotine is not smoking. It targets specific neuroreceptors involved in spike protein binding and neuroinflammation. This is temporary targeted use and not addiction. And there's also current information that may indicate that it was never habit forming, but we're not going to dive into that today. Why isn't my neurologist offering this? Most neurology protocols are symptom-based. Long COVID is systemic, immune-mediated, and metabolic. It doesn't fit neatly into one specialty. Are peptides experimental? Some are investigational, others have decades of data. They're adjunctive tools, not first line, and they're not DIY interventions. Why do some people recover and others don't? Because long COVID isn't one disease. It's multiple overlapping failures: immune, vascular, metabolic, neurological. Is this functional medicine hype? Only if you ignore the data. Mitochondrial dysfunction, micro-clots, and mast cell activation are mainstream findings. Application is lagging, not evidence. Download the free long COVID brain fog reversal checklist with labs, brands, and dosing schedules in the show notes. Text this episode to the smartest person you know who still can't find their keys. Stay metabolic, stay curious, stay sharp. See you next time. Thanks for listening to the Human Upgrade Project. If you found value in today's episode, share it with someone who's ready to elevate their biology. Make sure to follow the show for weekly deep dives into peptides, protocols, devices, lifestyle strategies, and the science of high-performance longevity. Until next time, stay curious, stay optimized, and stay 10x.